All right, your BLS exam is just around the corner, and I know you want to lock in those key facts like right now. Well, that's exactly what we're going to do. This is a high-speed review session designed to burn the critical numbers and the different protocols right into your memory so you can walk into that test feeling totally confident. So, you ready to ace this thing? Let's just lock in the facts. We're going to move fast here. No fluff, just the high-yield stuff you absolutely need to know to pass. Okay, first things first, let's just ground ourselves. What are we even talking about with BLS? It's all about that immediate care, right? Keeping the brain and organs going by managing the airway, breathing, and circulation until more advanced help can take over. The goal? Super simple. Save a life. So we're going to start with the foundation, the absolute baseline, high-quality CPR on an adult. You need to lay these numbers and steps down cold because pretty much everything else we talk about is just a tweak on this.
Okay, lean in for this one, seriously. These numbers, they are not suggestions. You have to know them for the exam. The rate, 100 to 120 compressions a minute. Depth, we're talking 5 to 6 centimeters. You gotta let that chest fully recoil after every single push. And interruptions, keep them under 10 seconds always. And that magic ratio, 30 compressions to 2 breaths. Seriously, burn this into your brain.
And don't forget this sequence. It's CAB. Compressions first for circulation, then you open the airway, and then you give the breaths. Why? Because we want to get that blood moving to the brain ASAP. Circulation comes first. That's the whole point. All right, now for pediatrics. This is where the exam loves to throw some curveballs. You got to pay super close attention to the small but totally critical differences between how you treat adults, children, and infants.
So you might be asking, why are they even different? And it really comes down to the cause of the arrest. For adults, it's usually a sudden heart problem, right? A cardiac thing. But for kids and infants, it's almost always a breathing problem first, like choking or drowning, that then leads to their heart stopping. And that one difference changes how we respond.
And this slide right here is a perfect example of that. This is a classic exam question, I guarantee it. If you're all by yourself and you find an adult down, you call 911 and grab the AED first. But if it's a child or an infant, you do 2 full minutes of CPR before you even think about calling for help. The whole idea is to try and fix that breathing problem right then and there. Okay, pulse check locations. Another thing you just have to memorize. For an adult, it's the carotid artery in the neck. Easy. For a child, you can use the carotid or the femoral artery down in the groin. And for an infant, it's the brachial artery, right there on the inside of their upper arm. Don't get those mixed up. Compression depth changes too, so remember, 5 to 6 centimeters for adults. For kids, it's about 5 centimeters, and for infants, about 4. But here's a great little rule of thumb that works for both kids and infants. You want to compress about 1/3 the depth of their chest. That'll keep you right on target. And of course, how you use your hands has to change. For an adult, you're using 2 interlocked hands. For a child, it could be 1 or 2 hands. You just have to size them up. And for an infant, if you're the only rescuer, you're using just 2 fingers. But hold on. There's a special technique just for infants, and it's a big one. If you have a second rescuer show up, you need to switch to the 2-thumb encircling technique. One person wraps their hands around the baby's chest and uses their thumbs to push, while the other person handles the airway. It's just way more effective, and you won't get tired as quickly. Okay, let's switch gears and lock out 2 more skills that are absolutely 100% going to be on your exam, using the AED and handling choking. When it comes to the AED, it's all about pad placement. On adults and kids, it's that familiar upper right chest, lower left side. And yeah, use pediatric pads for kids if you've got them. But for infants, this is key. The pads are usually too big to fit like that, so you have to use an anterior-posterior placement. That means one pad on the center of the chest and the other on the back, right between the shoulder blades. Now, for someone who is conscious and choking, the techniques are completely different depending on their age. For an adult or a child, it's abdominal thrusts, the Heimlich maneuver. But for an infant? No way, you absolutely do not do that. Instead, it's a sequence of 5 firm back blows, and then you flip them over for 5 chest thrusts. All right, we're almost there. Home stretch. This is our rapid-fire final review. Let's hammer home the most important numbers one last time. These are the ones you just can't afford to forget. Let's talk rate. This one is easy. For every single person, adult, child, or infant, the compression rate is always 100 to 120 per minute. It's universal. Interruptions. Anytime you have to pause compressions, whether it's for breaths or for the AED to do its thing, that pause has to be less than 10 seconds. Every single second you're not pumping, the brain isn't getting blood. It's that serious.
Okay, the ratio. If you're working alone, it's super simple. It is always 30 compressions to 2 breaths. Doesn't matter if it's an adult, a child, or an infant. One rescuer, 30 to 2, period. But, and this is a big but, here is the one time that ratio changes. And this is a super critical point for the exam. When a second rescuer shows up for a child or an infant, you switch the ratio to 15 compressions and 2 breaths. This gets them more oxygen, which, as we said, is vital for those pediatric arrests.
You know, when you boil it all down, all these numbers, all these techniques, they all point to one thing. The single most important factor for whether someone survives is you performing awesome, high-quality CPR with as few interruptions as humanly possible. So there it is, the critical numbers, the key differences you need for your BLS exam. Now take a second. Which one of those things we just covered, the lone rescuer rule, that 15 to 2 ratio for 2 rescuer infant CPR, the choking procedures, which one are you going to go back and review one last time before you walk into that exam room? You've got this. Good luck.